So following up on a look of what spending is and kind of how it's changed, let's talk about why that is. So if we look at healthcare spending and comparing it to the early 1900s to today, there's been a big shift. We've talked about some of it. So in 1900, we talked about in 1930 roughly, that a lot of the spending was out of pocket, a lot of spending was out of pocket. Today, we're only doing 11% out of pocket. So if we go back to 1900 and kind of look at where healthcare spending was, we have mostly that two-party transaction, where a lot of the transaction was money being given to the providers in exchange for medical care and services. There was some money that went from patients in public to charity, and then the charity used it to pay the doctors and hospitals, but that was a relatively small amount. Over time, that has really evolved. And today, we have much more of the third party. All right, we have a lot more of, this government up here. Now, we still have that transaction between the patients and public to the hospitals and doctor, where patients and public are giving their money. In exchange, they're getting their medical care services. But again, that's only 11%. We're paying on average 11% of our bill out of pocket to those providers. Well, where does the rest of it come from? It comes from here. So we have our insurance and we have the government care. So we have private insurance, we have Medicare, Medicaid. There's also some charity in there, but in general, what happens is we as patients or the public, individuals as a whole, we pay via premiums. We pay our insurance plans, to cover under that plan, and via taxes, we pay the government. Now, there's also charity in there that we can pay into. So what happens is that other 89%, that gets paid outside the 11% out of pocket comes from these groups up in here. And it's made via reimbursement. And so your insurance plans, the government, they pay that other 89% directly to the hospitals and doctors. Now, there is one thing that needs to be clear here, and that's every dime that comes from here, that comes from this reimbursement area, every single dime comes from this amount here. So the government never really pays. The insurance companies never really pay. They're more financial intermediaries. They collect money via people covered under the plan or the public, and they pay it out. That is the extent of what they do. Now, that is not saying that everything that gets paid via premiums and taxes goes towards the reimbursement, because insurance companies keep profit. They have to pay staff. But everything on this side of the equation has to come from here. And so, just kind of getting back to that, and let me move this down here. So what we've been seeing then is that over that period where we've been paying, as that insurance has really grown and we're paying less and less out of pocket, the spending per person has been going up to about $10,000 as of 2015. Where's that money going? Large percentage is going to, was going to hospitals. Now it's been backed off a little bit. Same with physicians. So it's getting spread out a lot more over time. Now, the other thing to note is the hospital days. And we're looking at that and we're seeing, okay, well, it really peaked in 1970. But, okay, well, hospital days per person. Less than a day in 1929, 1.2 days on average in 70, and 0.6 in 2012. So you might look at that and say, okay, good. You know, we're going less. And the same is with physicians. Physician visits went up, and then it went down again. But then the problem is that these hospitals are now employing a significantly larger number of people. Less than a half to 2, up to 7.8. All right, that's 7.8 hospital employees per patient. So that's where the money's going. All right, people are going to the hospital less. They're staying fewer amounts of time, but they're getting more people there for them. So that's a pretty big issue, and it's a trend that we've been seeing.